Hello, viewers. I welcome you to Padre Dr. Kuromi channel, PDO, compliment of the season to all of us, especially as we gradually approach Christmas. It's my prayer that God will make the Christmas a beautiful one for all of us. So today I want us to quickly talk about the gradual resistance of the antibiotics that we are using and the alternative that we can actually go for, especially now that it is becoming a source of concern to a lot of healthcare practitioners. Just some days back, or let me say weeks back, I was privileged to listen to the trending doctor at the moment in all social media platforms. You know what I'm talking about. It's no other person than a Aproko doctor himself, who is really doing well in expressing a lot of health care delivery that is necessary for us so that we can be able to live healthy life. And in one of his topics that he gives online, there is one that particularly moved my interest, where he talks about the gradual fading or the gradual resistance of the antibiotics that is being used in treating bacterial infection and other kind of infection, that these antibiotics are gradually becoming resistant. It caught my attention because even in the field of phytomedicine, as a herbal doctor, it is really becoming something that it's a source of concern, because almost every now and then we keep hearing people come to us to tell us that they have tried orthodox medication, especially antibiotics, in treating some infection, and they are not really getting any results. That if they go to hospital after they have been given injection for a while, let's say a week or some days, the infection will leave them, and after a while, not even up to 2 months, maybe say close to 2 weeks, the infection is back again. Now, what is the way forward? But before I go to the way forward, let us quickly look at what our Aproko doctor was really saying, if what he was saying or if what he's saying is very, very valid. Yes, it's very, very, very valid. And I think it's high time that we begin to take caution about our health. And when our Aproko doctor was giving this topic about the resistance of the bacteria to the antibiotics, he said something like there are ways we can actually use so that we gradually curtail the excessive use of antibiotics, so that the antibiotics can still be able to work in our body. But in the case where it can't work again in our body, then that's where we come in, the herbal doctor. And when the antibiotics was invented some time ago, the inventor actually said something that humanity has found peace, but the time will come that the bacteria themselves will actually bounce back to fight humanity. The idea of bacteria becoming resistant to antibiotics, it's not something that is far-fetched, because everything wants to live. Everything that is created in this world wants to live. Even down to the mosquito wants to live, even though the mosquito is feeding on the human blood to live. Everything that is created wants to live. Even we human beings, we want to live. So, according to the theory of evolution, survival it's the reason why we are in this world. We want to survive. And in an attempt to survive, we go extra mile, we pass through difficulties, we pass through a lot of challenges. No matter how hard the environment presents itself to us, we still find ourselves to see that we want to get survival by all means. The same thing is applicable to the bacteria. The bacteria in our body too, the harmful one, or whether or not the harmful one. They also want to survive. So, for instance, after a while, when the bacteria regain themselves, they now become used to the process of the antibiotics that were used upon them. So the reality of the bacteria becoming resistant to the available antibiotics is a truism that we all need to take serious care and caution. And when our procure doctor was talking about this, the resistance of the bacteria, he said something that the ways we can help ourselves is, first of all, by not making too much. We use antibiotics a lot. Anything antibiotics, anything antibiotics, anything antibiotics. And also too, how do this infection actually get into our body? When we do not take proper care of ourselves, we do not take proper care of our surrounding, we can make our surrounding look clean and neat, so that to avoid the excessive passage of bacteria. And also to our palms, we must not forget to always wash our palm. It's very, very important, because this is one of the ways that bacteria do pass into our body. And let's come to think of it. In my practice so far in the herbal medicine, I have treated a lot of people of infection. And what are these infections? They range from gonorrhea, staphylococcus, syphilis, chlamydia, what have you. They are much. And most of them, they do come to me and say, I have tried the orthodox medicine, the orthodox antibiotics is not working. So one thing, the good news is that even if we have the good news, it doesn't mean we should misuse the good news. The good news is that in the traditional herbal medicine, we have stronger antibiotics that a lot of them, the leaves, the herbs, the roots that God has given to us, they are all there. They have phytonutrients, phytochemical nutrients that are capable of fighting a lot of infection in the body. Just like the leaves are different, they have different names. So also their phytochemical nutrients are different. There are leaves, their potency is purely to take care of pains. There are leaves out there, their potency is to take care of malaria. There are leaves out there, their potency is to take care of headache. There are leaves out there, their potency is to take care of purely bone issues. We also have leaves out there that their potency is to take care of issues related to the eyes, issues related to the ear, mental issues. Every leaf out there, God has bestowed in it the ability and the capacity to be able to have one thing it is doing. The balm of Gilead also brings to question also when God asks, are there no more physicians in Gilead? Who are the physicians? Those who are using herbs to cure the people as at that time. So the good news is that in the traditional setting, in herbal medicine, we have antibiotics, and we that are in this area, we know how to go about our work. We know how to take care of our work. We know how to ensure and give you proper dosage of antibiotics and herbal antibiotics that will help you to regain yourself. God has always been great, that at every time He has always provided alternatives to humanity to be able to survive, because His creation He has created, He will always provide what is going to take care of the creation He has created. And that is why I am pleased to tell us also, in places that the orthodox antibiotics has failed, that is not really giving us the desired results, let us try the traditional antibiotics, because the traditional antibiotics are very, very, very powerful and very, very efficacious. So that's the good news I have to tell us. Let us not lose hope. Humanity, even though as the orthodox antibiotics is gradually failing us, let us not lose hope. There is hope in traditional antibiotics. Thank you very much. If you have listened to this broadcast and you enjoy it, please Do not forget to press the notification and the subscription button so that anytime I upload a new video, you can be able to see it. I remain PDO, Padre Dr. Kuromi. Thank you very much.